Welcome to Pharmacology Insights, where we break down complex pharmacology into simple, easy-to-understand concepts. One of the most promising breakthroughs in acute myeloid leukemia therapy doesn't work by blasting cancer cells. It works by flipping the genetic switches that keep them frozen in an immature state. Today, we're looking at Ziftomenib, the first FDA-approved Menin inhibitor for NPM1-mutated acute myeloid leukemia. Acute myeloid leukemia, or AML, is an aggressive cancer of the bone marrow. Here, immature myeloid cells, called blasts, grow uncontrollably and fail to mature into functional blood cells. As these abnormal blasts crowd out the marrow, patients develop anemia, infections, and bleeding. AML is the most common acute leukemia in adults and one of the most challenging to treat. Among the many genetic changes that drive AML, mutations in the NPM1 gene are some of the most common, making up about 30% of all cases. When patients relapse after treatment or never respond at all, their options become very limited. That's why the FDA's approval of Ziftomenib on November 13, 2025, was such a milestone. It's the first Menin inhibitor approved for adults with relapsed or refractory NPM1-mutated AML. So, how does Ziftomenib work? To understand that, we first need to talk about Menin. In healthy blood cell development, Menin partners with a protein called KMT2A, also known as MLL. Together, they form a transcriptional complex that activates genes such as HOX and MYS1, which are normally important in early blood cell formation. As blood cells mature, these HOX and MYS1 genes are supposed to switch off. But in NPM1-mutated AML, this Menin KMT2A complex becomes abnormally active. HOX and MYS1 genes get stuck in the on position. This blocks differentiation, traps cells in an immature state, and drives the uncontrolled expansion of leukemic blasts. This is where Ziftomenib steps in. Ziftomenib is designed to break the Menin-KMT2 interaction. It fits into the binding pocket of Menin, preventing KMT2A from attaching. Once this complex falls apart, the HOX and MYS gene expression drops, and leukemic cells finally begin to differentiate again. Their growth slows, and the bone marrow can resume making healthy blood cells. Unlike many cancer drugs that work by directly killing diseased cells, Ziftomenib works by restoring normal maturation, a fundamental shift in how we approach AML treatment. Ziftomenib was approved based on the Phase 1/2 KOMET-001 trial, a combined early-phase study evaluating its safety and anti-leukemic activity in adults with relapsed or refractory AML carrying NPM1 mutations. The results were encouraging. About 1/3 of patients responded to Ziftomenib. Complete remission, or remission with partial hematologic recovery, occurred in 21 to 23% of the study population. More than half of the patients who reached remission became MRD negative, meaning highly sensitive tests could not detect leukemia. The median overall survival was about 6.6 months, and responders tended to live longer. The safety profile was considered manageable. The most common issues were neutropenia and differentiation syndrome. For a heavily pretreated, poor prognosis population, these outcomes were considered clinically meaningful. Ziftomenib marks a major step forward in precision medicine for AML. By targeting a key molecular driver and restoring normal differentiation, it opens a new treatment pathway for patients with NPM1-mutated disease. And this is likely just the beginning. Menin inhibition is an active area of research, and future studies are already exploring combination strategies that may improve outcomes even further. And that's it for today's pharmacology video. If you enjoyed this video, please give it a thumbs up and subscribe to the channel for more pharmacology content.